these big corporations, big pharma, are actually psychopathic.
You've got a lifetime of an ailing human being from cradle to grave.
The talk title was Big Food and Big Pharma Killing for Profit with a question mark. I think the question mark can be removed now. Although they're allowed to develop drugs, they should no longer be allowed to test them.
And yet there are no consequences. Do you think there ever will be?
They don't understand that the real root cause of the pandemic of chronic disease are these very industries that they are supporting. Callous unconcern for the safety of others, incapacity to experience guilt, repeated lying, and conning others for profit. Everybody needs to know that. Every politician, every doctor, every member of the public, as soon as they know, when they hear the word big pharma or big corporation, the first word that comes into their mind is psychopathic, then we will start to win this battle.
Hi, Dr. Aseem Malhotra. It's lovely to see you. When we last spoke together, it was about your documentary, First Do No Farm, which was just making its appearance. How has that been going, and how has it been received?
Great to talk with you as always, Neil. Actually, very well. We've screened it in many different places. We had a screening at the beginning of my trip here in Capitol Hill, which was hosted by Senator Ron Johnson. Very well received. People just praising it constantly. They feel that it is definitely the documentary that helps people understand why we have this over-medicated society, why we've got this pandemic of chronic disease, but also offers solutions. The root cause of the problem is that it is really based upon the excesses of corporate capitalism. And, the big pharma are now in a position where they've had increasing both unchecked power, both visible and invisible over many, many years, to the point where they are now essentially a tyrannical force that is oppressing information that is going to be helpful to improve people's health. So I think there's lots to chew on in the documentary, but I've been all over America, and the response has been pretty extraordinary.
It's just that there are many themes, I suppose, within the documentary. For those that haven't seen it, and I would urge everyone to see it. But it's that big pharma undoubtedly wields political power because of its great wealth, and it's at the moment they can shrug off what sound like eye-watering fines when they are convicted of wrongdoing, but they're able to shrug off enormous fines because of the scale of the profits that are involved and that are a product of this industry.
Absolutely, Neil. If you go back many years, even before the pandemic, I was so concerned about the fact that they had been committing this fraud for so long, deliberate deception in order to make money, because that's what they're incentivized to do almost legally. And being responsible for, again, this has nothing to do with the pandemic, it's pre-pandemic, killing millions of people. That I, on 3 separate occasions using mainstream media, which included the Daily Mail, the Guardian newspaper, the BBC, the I newspaper, over a 3-year period, starting in sort of 2015, I called for a public inquiry. I said this is of the scale that we had in regards to, it needs an inquiry of the scale of the Chilcot inquiry into the Iraq War. And I even went to the European Parliament in 2019, Neil, and actually gave a talk with Sir Richard Thompson, who was the past president of the Royal College of Physicians and former personal physician to the Queen of England, who supported me on this, with this talk. And the talk title was Big Food and Big Pharma Killing for Profit with a question mark. I think the question mark can be removed now. We know that that's what they've been doing for a very, very long time. So it does need political action to solve the problem, because they've got to this position where they can control medical knowledge because of deregulation policies. And in fact, if you go back to when this really all started to accelerate in a negative direction, it was actually policies implemented by the likes of Ronald Reagan and Margaret Thatcher. Milton Friedman, who was the Chicago economist who got a Nobel Prize, who was the chief advisor to Reagan and actually largely responsible for our current economic system, said, paraphrasing him, "It is immoral, Neil," he said, "it is immoral for big corporations to put people ahead of profits." Now, why am I saying this? Something very interesting has happened very recently. as you well know. Donald Trump, who is now, as part of one of the main focus points of his campaign, in large part thanks to Robert Kennedy Jr., has put public health as a major, issue for his campaign. But within that, he has said that actually, if drug companies are found to be defrauding the American public, or found, it's very interesting, he used in quotes, or found to be putting profits ahead of people, they need to be investigated and held accountable. So this is ironic because, Donald Trump actually, during his presidency, probably accelerated the deregulation of big industry, including the likes of Big Pharma. But I think the positive side of all of this, Neil, is that he can be turned, and he has been turned in my view. So I think he now understands that economic system that he thought was actually having a net positive effect on the American public and the economy is actually in large part having a net negative effect now, primarily because of these two big industries that are destroying people's health, big food and big pharma.
Has your fight moved to the US now? You seem to be spending a large portion of your time on the other side of the Atlantic. From me, is that strategic from your point of view? Do you feel that you need to be there?
To some degree, yes, Neil. I mean, it's a global problem. It's a global fight. As you know, I've traveled all around the world giving talks, trying to help people understand the failures of the healthcare system. I've used, obviously, the example of the worst, the greatest example of this failure actually happened with the rollout of the COVID vaccines and all the damage that that's done, and the fact that the information on their harms still continues to be suppressed. Because it's a global campaign and because we're an interconnected world and community through social media, for me, America really epitomizes what happens when you commercialize a healthcare system. It's something that we should be very careful of that's happening in the UK, is that when you commercialize a healthcare system, you end up actually with poor outcomes. So America spends, compared to other wealthy countries, more than any other country in healthcare, over $4 trillion, but have the worst health outcomes. So for me, the influence of America, which has a huge influence in the world, I think if we can sort out the issues in the United States, then the rest of the world will follow. And of course, 70% of the profits of the pharmaceutical companies actually come from America, from their work, what they do in the United States, and then it spreads all around the world. So yes, to some degree strategic. I think something else as well that's worth mentioning is, when I, at the end of 2022, I had worked very, very hard over 9 months to put together a peer-reviewed paper, which was published in the Journal of Insulin Resistance, really laying out the pandemic, how we got, so vulnerable to this pandemic of misinformation on the COVID mRNA vaccines, and gave a root cause analysis of how it happened. And Neil, I won't name this journalist. I've worked with this journalist many times over the years. Everything I've done when it comes to my advocacy, whether it's been highlighting the harms of excess sugar and ultimately being a lead campaigner behind the sugary drinks tax, around getting the introduction of low carbohydrate diets as a management for type 2 diabetes, changing the science on saturated fat causing heart disease, which it doesn't, overprescription of medications, even coordinating a campaign between the medical Royal Colleges and the BMJ against too much medicine in 2015. Everything I've done through a medical journal publication has hit the news, largely in part because I wanted it to hit the news, because I don't write for the sake of publishing. I write because I write on issues I think are very important for public health and try to shift the conversation. And this was the first time that a publication I've done, probably in the last decade, where it didn't hit the mainstream news straight away in the UK. And I was absolutely gutted at the time, and I had to think outside the box. And of course, we have so many different outlets to get the information out. And I was actually really pleased and delighted that I was able to discuss this on GB News. And that was, on the Late Show that day with Dan Wootton. And that then led to so many other things. Interestingly, the very first person, I've not been public about this, the very first person to call me as I walked out of the GB News studio, who had got my number from Dr. Robert Malone, was Robert Kennedy Jr. And he said to me, he'd seen my paper, he'd seen the publicity, he'd been watching GB News probably live from the US. And he said, Dr. Malhotra, I want to thank you for your courage. And that's how we connected. Then he interviewed me for his podcast. I explained all the issues around public health. I went to meet him in Malibu for a talk I gave at the end of 2022. And I remember walking away and listening to this man. I was so impressed by him. I've always been impressed with, his family, his uncle JFK, his father Robert Kennedy, and I saw that this man was following the footsteps of those relatives and understand the public health issues in so much detail with an encyclopedic knowledge of American politics, its history, wanting to restore America to be the moral authority in the world. And I remember walking away, and two of his advisors on children's health defense, when they were dropping to the airport, I said to them at the time, I said, this man needs to run for president. And they looked at me and they were a bit like surprised. And I said, no, this is exactly his time. Now, I don't know whether that got back to him, but obviously a few months later, he announced that he was going to run. But of course, the Democratic government at the moment, they did not allow him really to even, get to the point where he could be potentially elected as president. So he went to them, but ultimately he's aligned himself with Donald Trump in large part thanks to, very interestingly, a former Coca-Cola and pharmaceutical industry lobbyist turned good called Callie Means, who's realized all the destruction that these big corporations have been doing. And now with his sister, who's a former surgeon at Stanford, they have been very, very powerful, strong advocates for this movement and are saying all the right things.
I've spoken to Cassie, and I'm very much aware of what Casey and Callie Means have been saying. But I wonder, when you talk about Robert Kennedy Jr., do you think it's a pragmatism in a sense, because his focus has for such a long time been about health, particularly children's health in America? When you look at the Trump campaign and so many of the geopolitical issues, it's hard to see that they necessarily align with Robert F. Kennedy Jr. But do you think he's just made that pragmatic choice that his absolute priority, Kennedy's, is health, children's health, and that he sees there's at least an open door that he can push on with Trump?
Completely, Neil, and absolutely, and that resonates with me. But I think what's interesting is the power of changing minds of people that you think would not normally even go into this space. It's extraordinary that Donald Trump made that statement, saying that if they are putting, profits ahead of people, they need to be investigated and held accountable. But that's actually their business model, So maybe Donald Trump doesn't know that. And I think we have to accept that there is a lot of ignorance out there. There's willful ignorance when it comes to political ideology on these issues. Very honestly, my aim as a doctor is to reflect the evidence of what the best solutions are to improve public health, which will involve policies, of course, that are needed to really ensure that, we can protect the public from these excesses and manipulations of industry. But, traditionally, Neil, if you were to choose a political party that was more aligned with those values and on the evidence of public health, it was actually coming from the left. It was traditional Labour Party values. It was Democratic values. But everything seems to have flipped right now. I was shocked to learn that Kamala Harris, for her campaign, has received, more than $500,000 from Big Pharma, whereas I think the Trump campaign has received something like $200,000. But if you go back, over the last decade or so, and look at the political parties in America, they, in equal amounts now, take money from Big Pharma. And Big Pharma spent a lot of money lobbying these. They spent, even pre-pandemic, almost $500,000 per congressman or congresswoman on lobbying them for their interests. So, it's a uni-party system. I remember when this issue was coming up with my concerns about Big Pharma, inspired by the British Medical Journal 2012 launched this campaign against too much medicine, and the whistleblowers started contacting me about various things going on. And I raised concerns which actually got onto BBC News. I helped to get into BBC News. I wrote about in The Guardian about a clot-busting drug that was being used for stroke and how the data on it was not reliable, flawed, and was likely causing a net harm, probably killing people without benefiting people. And this got some attention. There's a publication in The Lancet on it. And I remember going and speaking to Andy Burnham, somebody I consider a friend. He's a mayor of Manchester. He was a former Secretary for Health, remember. And I told him what was going on. And he said to me, Aseem, and it was straight from the horse's mouth. He said, the Department of Health is too close to industry. Now, he said that several years ago, but what have we seen recently in the UK? Apparently, one of the most important ways to tackle the obesity epidemic is to give as many people in the UK this weight loss drug Ozempic, which is now linked to at least 10 clear deaths in the UK. I mean, this is the same situation happening all over again. And I think it must be gross ignorance from the likes of Keir Starmer to this problem. They don't understand that the real root cause of the pandemic of chronic disease are these very industries that they are supporting, big food and big pharma. They need to understand what's really going on. And if they do that, Neil, and of course I made that documentary to get to the policymakers as well, they won't be able to unsee it. I don't think this is deliberate, malicious, wanting the health of the population to worsen. This is going very much in the wrong direction, and we need to turn it around. We need to turn the ship around.
What troubles me most, Aseem, I think out of all of it, is that there is, by now, 4 years in, there's so much damning information that's freely out there regarding, the lie that we were told about the interventions being safe and effective, which they plainly were unsafe and ineffective, that you were to take them to protect other people when there was no information that those products would stop transmission. The Azra Ghani Lancet piece about saved millions of lives, vaccines saved millions of lives, which was mathematical modelling, which even the medical fraternity were saying was only an opinion piece, and yet it's out there as holy writ. Vaccines saved millions of lives. All of that information is freely out there now. You can talk about it plainly without having to hide it, and yet there are no consequences. Do you think there ever will be consequences? I
think there has to be, Neil. There has to be accountability. I think, one of the things that the diagnosis I came up with, which actually was inspired by Robert Hare, the forensic psychologist, who was behind the original definition, international classification defining psychopathy, was that we have these corporations who are psychopathic in the way that they conduct their business, right? Pathologically self-interested, but there are ways that they exert their power. And one of the ways they exert their power is something called opposition fragmentation. So there are people who are interested in asking the right questions, who have courage and integrity. And what they will do is they will smear us, they will try and silence us. So I think what's happening is that information is there, Neil. It seems very obvious to us. But I think what's happened is because there's other information contradicting it, like this, for example, the vaccine saving millions of lives, we are being painted deliberately by these psychopathic entities as being the bad actors. It's the worst form of gaslighting I've ever seen. I've faced backlash behind the scenes for several years now. It happened with statins, but during the pandemic, even when I started campaigning against vaccine mandates for healthcare workers, and successfully did that because I got messages through the BMA chair to Sajid Javid. And also thank God to the fact that, I think 80,000 to 100,000 NHS staff refused to get the vaccine. So they realized it was going to be a mess and they dug their heels in. All these things played a role. But that behind the scenes attacks on me, trying to go after my medical license, destroy my credibility, is actually coming from other doctors who don't even realize they're probably being used by those psychopathic entities to try and smear my name. And it is effective. I have people that I've met, that I've worked with, who are seeing all these negative articles sometimes written about me or different things that are happening. And they then start to believe it until they come to a talk of mine. This happened in America. And a guy came up to me to apologize and said, listen, Aseem, I've known you for a long time, but I started to have doubts then because of stuff I was reading, right? And I've just seen your talk and now the penny has dropped. So part of the tactics of these industries is to suppress the truth getting out or to confuse the public. And this is something that, we just have to call out, Neil. We just have to keep fighting and keep talking about it. I think there's been a ripple effect. I think things have changed. There was a report recently in America that 85% of healthcare workers in the United States have refused boosters of the COVID vaccine, despite recommendations from the CDC. So there is a shift happening. We're in the middle of a revolution. And I think, this election result, I think is going to be huge. It's going to have huge implications. Never in American history in an election has public health been such an important defining issue about who is going to, who's going to win. And I think, and my hope is that the impact and influence of the likes of Robert Kennedy Jr. on Donald Trump is going to have a huge impact over the next few years in terms of actually turning this dial the right way.
Have you seen, I'm sure you have, the figures that came out of work by, overseen by Dennis Rancourt? I recently saw Ed Dowd talking with Brett Weinstein about the sheer scale of the death and injury caused by the mRNA products. And it runs to tens of millions. The figures are truly chin on chest. I wondered if you had seen those figures and how you reacted to them if you have.
Yeah, I haven't seen those figures, Neil. What I would say is I always go back to square one, first principles on the evidence, and the original randomized control trials, which led to the approval of these products, led to coercion mandates. That reanalysis independently, which is stood up to scrutiny, published in the journal Vaccine. Lead author Joseph Freeman, who I know, associated to the BMJ Peter Doshi, they found that from the very beginning, in the short term, there was a serious adverse event rate from the vaccines of mRNA products after 2 doses, which was approximately 1 in 800. This was replicated in Norway, by the way, in real world data in Norway. And they didn't know about this, interestingly. I pointed it out because I referenced it in my peer-reviewed article of around 1 in 927 people who were admitted to hospital within a couple of months of having, or within a few weeks of having the COVID vaccines, had a doctor's diagnosis that this was a serious adverse event because of the vaccine. So we've got replication of data there. But that's only the short-term harms, Neil. You're absolutely right. And that means that doesn't account for all the other things that are emerging later on. And we do have some reasonable, good quality mechanistic evidence, as well as real-world anecdotal information coming out from the likes of Professor Angus Dalgleish, that there does seem to be a link with these vaccines and the proliferation of cancer. I, as a cardiologist, made the diagnosis that it would accelerate heart disease in 2021 and would lead to excess deaths and increase heart attacks. We've seen that happen. It's all very, very clear to people like us that are willing to critically appraise the evidence. But the reason this isn't now mainstream news, and to be honest, it is, I think, there's one thing making a mistake. I don't think this is deliberate. This is how big pharma operate, right? Try and get a product out. They were hoping for the best, but they've likely covered up all of these mistakes. And then the willful blindness from certain sections of government and health departments to this, I think, is almost a greater crime, Neil, to be honest. And in terms of the figures, if the 1-800 serious adverse event rate is correct, and it likely is an underestimate, then if you vaccinate 3 billion people, you're gonna kill or seriously harm, and I've said this before, at least 3 million, right? So they're not far off, and it's really, really bad. It's almost, I wake up every morning thinking, is this real? This is like a living nightmare. I'm also personally affected because the last surviving member of my immediate family, my father, my best friend, in my view, almost certainly was, who killed, by this COVID vaccine because it caused a sudden cardiac death in him, and his postmortem findings fit with what we know mechanistically these vaccines can do. And I now am in a position where I'm having to answer the GMC because there are allegations towards me from anonymous doctors. Some of them have made themselves public. That I am spreading misinformation. The vaccine is clearly safe and effective, and I am bringing the profession into disrepute. Can you imagine that? My argument would be, Neil, is that the very doctors and certain sections of the medical profession, and I've got to say it is a small minority that are doing this, they themselves, by trying to silence people who are speaking up for patient safety, they are the ones, Neil, I'm going to say this for the first time publicly, they are bringing the profession into disrepute. And they need to be held accountable. And because this sort of rhetoric, this sort of malicious, these sorts of malicious allegations are actually stopping us actually making progress in actually getting a full acknowledgement from the medical establishment and helping the vaccine injured and trying to figure out ways to stop this happening again. We are taught as doctors, if you make a mistake, what patients want, they want a sincere apology because most people are well-intentioned. They want to know you're well-intentioned. But what they really want, right, is they want you to say, I'm going to implement strategies to make sure this never happens again so nobody else is harmed. That's all that needs to happen. And Chris Whitty, our chief medical officer, isn't there yet. I believe him to be a man of great integrity. I've never met him, but people who know him say he is. Maybe he's afraid, like many other people. I've spoken to 2 former government ministers, Neil, in the last year when the Tory government were in power, and spent time with them, and they fully acknowledged and realized after spending several hours with me that there was a major problem with this vaccine. They were too afraid to speak out. partly for political reasons. They thought it would collapse the government. But this is just a reflection of us being under a corporate tyranny, that every single person, including the president, etc., is potentially afraid of speaking out because the real power is with these corporations. And that's where we are, Neil. That's where we are. That's what we have to deal with.
So egregious within all that. When I spoke earlier about consequences and the lack thereof, the products were pushed so heavily towards pregnant women. I thought when there's mounting evidence that the big pharma companies knew in advance the kind of consequences that there would be on the reproductive capacity of women, full stop, and on the fetus, but nonetheless, that it was pushed at the highest levels that pregnant women should take these products. That there have been no consequences for that, I find surreal.
Yeah, Neil, I mean, I personally haven't delved into in great detail the issue on pregnant women, but I think you raise this point, this concept, which I've mentioned before, is that, these companies historically, when they know, and there's a great case of Vioxx. This is a drug that was produced by Merck in the late 90s, a blockbuster anti-inflammatory, marketed to be better than ibuprofen. That when they were told and they knew that it was causing increasing heart attacks, at least twofold, by the FDA, they doubled down on their marketing. And they purchased more reprints from the New England Journal of Medicine, who, medical journals receive often millions from these drug companies, to use as marketing material and to give it to doctors so that more people could take the drug. The only and the best diagnosis for this, Neil, and I'm very willing to, and by the way, interestingly, nobody has challenged me on this. I'm very up for debate. No single person has challenged the diagnosis from Robert Hare, which I've now perpetuated, that these big corporations, big pharma, are actually psychopathic in the way that they try and extract money from the taxpayer and from the population. Callous, unconcerned for the safety of others, incapacity to experience guilt, repeated lying, and conning others for profit. Everybody needs to know that. Everybody in the room, every politician, every doctor, every member of the public, as soon as they know, when they hear the word big pharma or big corporation, the first word that comes into their mind is psychopathic, then we will start to win this battle.
Yes, in the next number of hours or days, RFK Jr. and the likes of Casey and Callie Means find themselves next door to power. What would you hope, or if not expect, to be done in short order to begin to redress and to remedy this situation, this huge power of big agri, big food, big pharma, and its consequences for health in the US? What would you want to see happen?
Yeah, Neil, I think first and foremost, the most important thing is it needs legal political intervention. So I think when it comes to big pharma, the low-hanging fruit, and I think they've had their time now, is that although they're allowed to develop drugs, they should no longer be allowed to test them. What they do is they control the design, the conduct, and analysis of these studies. They hold on to the raw data. They give summary reports to the regulator that they pay, and then we're supposed to just believe the results. And I think that trust is gone now. They shouldn't be given any leeway on this. And in fact, what it will also do, Neil, is it will encourage real innovation. Because if, what the problem at the moment is not just about these harmful drugs where people don't understand the true benefits and harms. Most of the new drugs they produce in the last couple of decades have been copies of old ones. They find an old drug, generic drug that's off patent, that's cheap. They change the molecules here and there a little bit. They rename it. They make lots of money, and they just carry on. So it's huge waste in the system. So this would change. I think regulators shouldn't be taking any money from industry. The MHR in the UK, for example, shouldn't be taking 86% of something from pharma. I think it's an absolute scandal. FDA takes 65% in the US. That needs to stop. And then on the other side, of course, I've been a big advocate for the impact of lifestyle on health. I know that from population research. I know this from my own experience with patients. You could rapidly improve people's mental and physical health purely from dietary changes alone. There are so many things that are important, but I think the low-hanging fruit is that we need to really curb the consumption, certainly in the Western world, other parts of the world as well, but in America and the UK, of ultra-processed food. And that can happen by using the same strategies we use to curb tobacco consumption. That means raising the price of ultra-processed food, making healthy food more affordable. It means banning the sale of such foods, for example, in hospitals, right? Why are hospitals, 70% of the food purchased in hospitals is ultra-processed food? It doesn't make any sense. We're actually making the problem worse. We're also making people think that food isn't that important. And it's all to do with, taking pills, for example. So there's that needs to be introduced as well. And a public health education campaign as well, just to educate people. We have to educate people. What is ultra-processed food? Why should you avoid it? Going back to the traditional, it sounds strange, if we went back to traditional English diet of meat and 2 veg, we wouldn't have this pandemic of chronic disease.
I don't think I've ever been struck as forcefully as I was by a comment by Casey Means in relatively recent time, where she said there is no more valuable commodity in the United States of America than a sick child. You've got a lifetime of an ailing human being from cradle to grave, where you make money from them with ultra processed food, and the big pharma response thereof.
Absolutely. I mean, the business model, actually, the ideal scenario for big pharma is to get as many people taking as many pills for as long as possible. And if they could, they would encourage or create some false data to suggest that we should give children statins, cholesterol-lowering drugs. And if they could, they would manipulate the law. That's why the law is important, to mandate it. That's what they did. That's another really important piece of information that people need to acknowledge now and I knew this intuitively at the end of 2021, when we had information by that stage the vaccine wasn't stopping infection, wasn't stopping transmission. It was associated with serious harms from real world data. That's when the mandates got introduced. Think about that, Neil. That's when it got. So I thought this must be coming. The only beneficiaries really financially from this would be big pharma. And that's why they're psychopathic. That's why we have to call them out. That's why it's called psychopathic behavior. Once they knew, in my view, that it was causing harm and wasn't stopping infection, to maximize their profits, to distract people and make them think it must be safe and effective, it's being mandated. That's what they did. And they manipulated politicians and the law to whatever way they could to introduce those mandates. It is a truly, truly, truly horrific crime. Truly horrific.
Dr. Aseem Malhotra, it's always simultaneously enlightening and frightening to listen to you speak, but I always feel the better for the information that you impart. Thanks so much for your time today.